this up, set you up the exact same way. There you are. Hips towards me, please. Thank you. And breath in, and all the way out. Good, good, good. Roll towards me. There we go. Tiny little hidden one there, right? You're going to take this, you're going to pull this, perfect. You're going to hold it right there.
Yeah.
We're going to bring this leg up and scoot your hips towards me if you don't mind. Good. And then you just relax. And let's take a breath in for me, please. And all the way out. There's a little one, and we're going to do one more for the lumbar, okay? Alicia, thank you for coming in today. Why don't you just take it away, kind of what you're dealing with, and then I'll kind of launch into my spiel afterwards. So
for sure.
Go right ahead.
So I have felt quite a bit of pain on my left side for the last couple of years, on and off. After I had my second daughter, I really noticed felt like my spine was out. Just didn't feel very comfortable.
Okay.
So sometimes radiates into my hip. I've had some issues in my knee in the past where obviously alignment was just off. So I'm really active, do lots of workouts, things like that. And as soon as I did more workouts, more intense weightlifting and things like that, that's when I really noticed
it
how
started
much it
to
was
flare up. Okay, so you said you've had it since the birth of your second.
Yeah.
It's always the second kid that's the troublemaker, by the way, as the firstborn.
Yes, yeah. So it was about 3 years ago. She's 3, so.
And since then, you've been dealing with that discomfort like every day, or is it only on the activity?
Yeah, it depends on the activity, and I think also just carrying my kids makes a difference. So I must be, I'm a right-handed, so probably if I'm carrying their weight in my right side, maybe that's impacting the alignment again. Okay. But for sure, when I'm doing the activity, that's when I can notice.
Okay.
Yeah.
And when the activity started, did you say resistance training, like weights? Did I hear that right?
Yeah. Okay. So I like to do like F45 workouts.
Oh yeah. Okay. Yeah. High intensity interval training type stuff.
Exactly. Okay. And I do yoga as well, but don't notice it as much there because it's much slower movement. Or I'll
more control.
Yes.
Right. Is there a particular movement during the high intensity interval stuff that you're doing that you find like really aggravates, that it really pisses it off, or is it kind of just the generic movement in itself?
Yeah, I think I would say lower body intensity, like if I'm doing
like squats?
Yeah, squats or even like a deadlift style. That's something where I usually do feel it because I know I'm kind of using that specific rotation. I guess there.
All right. And now with that, I know you said it was like the left lower side or left lower back. Are you getting any kind of symptomatology or pain down the back of the leg or down the leg at all? Or
I actually used to have pain on the other side, which was interesting. Yeah, so I wasn't sure if that was
how long ago was that?
I'd say within the last year.
All right.
And it's improved a lot.
Good.
Yeah, in the last little bit.
Did you see anyone for that, or
I
did it just kind of go away? Okay,
yeah.
What happened for it?
I was doing some chiropractic. I did some chiro treatments and then specific stretches in between my time to help target.
So a little bit of physical therapy in there too, and you find that kind of cleared up. Okay.
Yes.
Possible they're two different things. Kind of sounds like to me they are. If it's the other side and it's cleared up while that issue is still persisted, it's just a one-off, or however long off, right?
Yes, yeah.
Okay. Primarily lower back. Do you get any kind of stiffness into your upper back a little bit, or lower upper back rather?
I'd say lower upper back for sure. I'm a music teacher in my day job, so I move around a lot. But yeah, I definitely notice it as soon as I'm sedentary. Then that would be when I start to sort of feel.
All right. So when you're sitting more so too.
Yes.
Okay. So you find that getting up and moving though does help.
Yep.
Perfect. Really good. So she's already got the right mindset about activity being beneficial in the case of pains. All right. There's nothing worse than just remaining completely still once you've passed the initial stages of an acute injury. So that's awesome that we don't need to teach Alicia that. She's very familiar.
Thanks.
Okay. So what's going to happen today is we kind of covered most of the history component. We're going to get you on the table. We're going to do a physical exam. Okay. And then we're going to figure out, at least in this clinician's opinion, what's going on, and hopefully what we can do to improve the situation. Okay, does that sound good to you?
Sounds good.
Perfect. All right, so just start by just bending forward and touching your toes for me, or at least as far as you can get. Does that provoke any kind of discomfort on the left side?
No, it feels okay so far.
No? Okay. She's able to just skim her toes, by the way. You guys can't see that, but she's very close. Oh, no, she's touching it. Phenomenal.
I got him.
All right, and nothing in the left side with that?
No.
Okay, come back up. We're going to go the other way now. I want you to bend backward for me, okay? And please don't fall.
Yes.
Anything in the low back with that?
No.
No? Awesome. Okay, so that's not broken on. Can you do a body weight squat for me here? See if that comes off?
Yep, just like just a regular
Yeah, whatever way you normally do it. Yep. And then anything in that low back with that?
No.
No? Awesome. Okay, good. All right, so perfect. Your legs are just like so. You can see over my shoulder there. Good. Good. Relax the foot. Good. 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 Push the leg up into me as hard as you can. Push the leg up as hard as you can. Lift the toe up as hard as you can. Lift the toe up as hard as you can. Good. Perfect example of a normal lower limb neuro. So you're getting those on the left side, yes?
Yeah.
All right, so we're actually going to start with your right, then the normal side. We're going to bring this leg straight up. You let me know if you get any discomfort in the low back with that, or recreation of symptoms down either leg.
No,
No?
it's okay.
Good.
Good stretch.
Slowly lower down. Awesome. Okay, now we're going to go the other way. I'm going to bring this leg straight up. Anything in the back or the leg?
No.
Okay, slowly lower down.
Just tightness in
Just
my
some
hip
tightness
there.
in the hip
like it
region.
almost feels like it's gonna lock in when that moves all the way up to the top.
Okay, I'm actually going to come back over here. We're going to do a hip screen now. So I'm going to bring this up. A little clacky knee there. So I'm going to rotate you in like that.
Okay.
Feeling any kind of discomfort in the hip or no?
No, more lower back. I can just
Lower
feel
back when I rotate it like so.
Yes.
Okay. And now we're going to go ahead and go external rotation. Is that okay?
Yep.
Okay.
It's like a nice rush.
And we're going to bring this up. And now I'm going to do the same movements on this side. Anything in the back with that?
No, that was
interesting.
okay.
You actually have a little bit more internal rotation on this side
Do
too,
I?
which is a little strange.
Yeah.
But and any discomfort with that?
No.
No? Okay. Good. So I'm gonna place my hand behind your thigh here.
Yep.
And I'm gonna press right through. That's okay too.
Yeah,
You seem like you're doing very well so far.
that's good.
And bring this over.
Yeah, that feels fine too.
All right. I'll get you to flip over and go face down, or maybe mindful of your glasses.
Yes,
okay?
yeah. Oh, let me cover.
Okay. So that left side. So direct overpressure. Is that okay?
Yeah.
Wow.
Yeah, it's almost surprising.
You know, there is a rule out there that as soon as you go in to see a doc, everything's okay. You know, that's
Yeah.
it. It's really unfortunate. It makes our lives difficult.
The opposite
Yeah.
of the white coat effect.
Mhm. Okay, and then also on this side. That's fine too.
Yeah.
Are you able to point to where you usually do feel that discomfort when it does on-come?
Yeah, I'd say sort of here.
Okay,
Yeah.
so it's not located right here, but it's more a little bit higher
Yes.
over to the side as well.
Yeah.
Like the flank region.
Yeah.
Okay. Tender at all through here?
A little bit.
Teeny bit?
Yeah.
Okay, same location other side.
Yeah.
Anything or not particular? Just
No.
an annoying thumb kind
Yeah,
of
that
jamming
one
you,
feels
eh?
fine. Yeah.
Okay. Okay. Alright, and then up here. A little freebie release there.
Yeah, I was gonna say. You could feel that.
Unintentional. Yeah. So Alicia was mentioning that she primarily feels her discomfort when it does come on, because we're not having the greatest amount of success reproducing it in clinic here, kind of right in this region. Now obviously that's hard for you guys to see on camera, but I will put a little cutaway here of exactly what we're talking about. We're talking about the lateral aspect and the insertion of the quadratus lumborum muscle. All right. Now, as we know, the quadratus lumborum, it's our posterior or the back of our core, and it's very important to obviously help hold everything stable anytime we're doing any kind of bracing movement, such as a squat. Now, Alicia, she is a mom of 2, so obviously we do have some history of, we'll call it trauma, even though it's a very emotional and a very positive thing that happened to you, to her core musculature, and as such we do need to accommodate any kind of lasting weaknesses or lasting effects from that. So with here, we're going to be looking at kind of a bit of a rehab routine, trying to engage it more readily so that it can be more functional in our more dynamic movements such as squats. So for today we're going to be adjusting her, and we're also going to be doing some massage just to try to calm it down. Hopefully that can get her some increased mobility going forward for her high intensity interval training. There, summarized. That took about 45 seconds, but yeah. Okay, I will get you on your side facing out to the window. You're going to take this, you're going to pull this, perfect, you're going to hold it right there. Yep. We're going to bring this leg up and scoot your hips towards me if you don't mind. Good, and then you just relax in this position. Good. Oh, microphone's in the wrong location. Right, the whole point that people click Chiro YouTube videos, right? All right, and take a breath in for me, please, and all the way out. There's a little one, and we're going to do one more for the lumbar, okay? Breath in, all the way out. Good, good, good. There we go. Awesome. We'll get you on the other side. We'll bring this up, set you up the exact same way. There you are. Hips towards me, please. Thank you. And breath in, and all the way out. Good, good, good. Roll towards me. There we go. Tiny little hidden one there, right? So as we mentioned, Alicia's feeling her complaint primarily when she does feel it right here. You guys can probably see it better from this angle, but that is the insertion of the QL musculature right into her pelvis. So we will work that area primarily, but we'll go ahead and be thorough and just get everything while we're back here too. So now, Alicia, while I'm doing this, you did mention that in addition to being a music teacher, what instrument do you like to play the most? Side note.
I actually sing.
You're a singer?
Yeah, I'm a singer.
Oh, no wonder you and Santino get along. Okay.
Yeah, she's very musical too.
Exactly. But what? In addition to being a music teacher and a singer, what other business do you have rolling? Tell us about that.
Yeah, so I have developed I guess you could call it a whole self wellness space. Mm-hmm. Being a mom, I really realized in the early days that I just sort of forgot about everything that made me prior to being a mom.
I'm sure other mothers would agree.
Yeah, although it's, the best change to your life, it definitely shifts things for you. So I realized I needed to come back to some of the things I loved most. And I really love doing movement and just community events where you get to connect with other people. So I created a space, it's called Flow & Co. And I've done just a space where people could come together and talk about wellness. And we have an online membership now running, which has been a lot of fun, where we meet once a week and talk to different wellness experts. And they sort of support us through this self-reflective journey. And yeah, it's been really awesome. I'm loving it. And we do some in-person events as well. So I'm planning an event coming up in April in Waterdown.
Okay.
At Yoga Shala, which is where I do yoga. And then we're also going to do an in-person retreat in the fall. And I'm just kind of nailing down our date for that. So sort of bring all these ideas that we've done online, but in an in-person connection way as well. So
well,
lots of fun.
That sounds like it would benefit anybody who's interested in it. I'll leave a link to Alicia's website in the description down below if that appeals to anyone as well. So, no problem.
feels great.
Good. I'm happy to hear. We're just going to do this for about 5 minutes now, okay?
Yeah.
Ideally with silence for the whole, like some people love the sound of this stuff. So.
For sure.
So you take a nap.
Yeah, take a break. As soon as I'm still, I'm like, yeah, I think this is the first time I've done this all day. Taking a minute.
You're welcome.
Mm-hmm. Does it feel like I have tension there as a result? Yeah, I'm wondering.
Comparing this side to over here, I don't know, like, if you feel when I take my thumbs in there, do you feel an asymmetry between the two? Because truthfully, I feel like this is slightly more knotted than your right side.
Yeah. I could see what you're saying. I was curious. Do you think that's too, like, when I carry my kids are 3 and 5, and their weight, when I'm sort of counter...
Absolutely,
Yeah.
I think it could be. So,
in effect.
Obviously, when you're carrying the kids, you do need to rely more on your erector spine, as they're called, or the quadratus lumborum, so that you can stand upright, right? So, like, that is, carrying your kid, it is a form of exercise.
Yes.
But if you're not working on that muscle group that's required, it's going to end up becoming strained eventually, right? Because, I mean, that kid might be the heaviest load that you give to this region, especially, like you said, if you're hesitant doing those other kinds of extension-based movements, such as Cobra in yoga, which is a very safe-to-do exercise for healthy people, right? Granted, yes, you do have hip flexor tightness, but you can stretch around that as well. So that actually, you mentioning about picking up with the kids, that's another piece of the puzzle that I actually hadn't considered initially there. So that's good that you mentioned that too.
For sure. I try to carry both of them at the same time.
That
so that I'm at
sounds
least balanced.
effective. Oh no, that sounds efficient but not effective.
But not
that
effective.
makes sense.
Yes, yeah.
Oh man.
Yeah.
Extra off there. We're finished with the appointment for today, but I was just following up with Alicia regarding her QL strain. She seems like she's managing it really well. Would you agree with that?
For sure.
What have you been doing to try to manage it yourself? If you don't mind sharing.
Yeah, so trying my best to do some intentional stretching in between that is targeted in that area, or targeting that area, and just lots of movement. I, just have a lot of, like I was saying, I love to do yoga, and I'm not stopping doing movement. I'm just finding movements that work best for me.
She's also been seeing a chiro regularly and getting adjusted, which has been helping her. One thing I recommended to her is to explore other options as well, right? One thing she hasn't done yet is acupuncture, and I always say just because you're trying something new doesn't mean you need to discontinue the things that have helped you before, right? The effects of these kinds of manual therapies are really synergistic. Getting adjusted might be great, getting massage might be great. Those two things combined are going to be better than their individual parts, right? So if they do offer well, I know I offer acupuncture, but if they offer acupuncture anywhere else in conjunction to what you were doing, give it a try, unless you're needle averse, in which case, fine, that's a whole different story.
For sure.
But that would probably be the next steps for you if incorporating those extension-based movements doesn't bring you any kind of change or positive relief in those regions. So, do you have any other questions for me at all for today, or anything else you'd like to know about?
No, it was nice to have your opinion and just see what you think. And
good.
Yeah, I appreciate it. It felt good.
Always happy to give an opinion. So, thank you for coming in very much.
Thank
Appreciate
you.
that.
It's very nice to be here.